This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Okay, awesome. So I'm Lauren Shuda, and this is Chris Ng. We are the chiefs for MCW's PM&R program. Hello. And so to get started, Chris, how do I make your thing move? Okay. So about us, there are 18 residents in our program, 6 for our class. We start PGY 2 years, so we are categorical. Our home states vary from Wisconsin to Illinois, California, Colorado, Idaho, Virginia, and Minnesota currently. And then this is our program leadership. The great Dr. Goodfriend is our program director. She's amazing. She's also logged in potentially. I'm not sure, but she should be coming today. And then we have assistant program directors, Dr. Ketchum and Dr. Katsonis. Ketchum is at the Freighter campus, and then Dr. Katsonis is at the VA campus. Both are awesome. More about our leadership, we have Sue Abrams as our program coordinator. She's amazing and very responsive with emails. And then we have Dr. Diane Braza, who is our chair of the department. She's super fun to work with, and you don't really get to work with her a ton until PGY 3 year, but she's wonderful. And so then just a quick look at our clinical sites. We have 4 of them currently, as well as like clinics throughout the southeastern Wisconsin area, or Milwaukee area, I should say. We are at Freighter, which is paired with the Medical College of Wisconsin. It's our main hospital site. So it's where we do our inpatient consults, and then some of our clinics are in that building as well. And then we have Children's Hospital Wisconsin, which is actually connected to Freighter through a tunnel system. So that's kind of fun. And we have inpatient consults there, as well as I think we're in the working on getting 3 to 4 inpatient rehab beds for children's. And so that's in the works, should be happening, I think, January or February of this upcoming year, which is exciting. And then we have the MILWAUKEE VA campus, which is awesome. We have a separate spinal cord injury center, which has, I think, 50 some beds, currently active only like 30 of them. And then we have an inpatient rehab as well and clinic there. And then the new exciting thing for our program is we just opened a freestanding rehab hospital as of July 11th this year. And it's called the Freighter Blue Mound Rehabilitation Hospital. And it's new and pretty and beautiful, and we are very excited to have it. So our program design, just kind of giving you an idea. Most rotations tend to be about 2 months. Some are 1 month, depending on how it all works out. None are more than that. We rotate between Blue Mound, the VA, and Children's, especially as PGY 2. Those are kind of the only places you will see. But that's okay because it's fun and keeps you busy. We recently transitioned to the freestanding at Blue Mound, which I already mentioned, but we still remained within the hospital within a hospital system, which is fantastic because we just do discharge readmit orders, and we're still affiliated like with the inpatient side of Freighter. And so we're able to get consults from medicine and surgical services, and we still have like really great cooperation with those acute service teams, even though we are no longer located inside of Freighter. And then the way that we broke up the services currently are, it's kind of a mixed bag. You get a little bit of stroke, a little bit of TBI, a little bit of prosthetics, amputee, a little bit of spinal cord injury, a little bit of everything, kind of on all of the inpatient services. So both at Freighter and the VA. And then, as I mentioned, we do have a specific spinal cord injury unit at the VA, which has, I lied, only 38 beds, but it is fully specialized spinal cord injury. And so you get to see not only acute patients, but also like patients who are coming in chronic spinal cord injuries, but they're coming for acute issues, whether it be a hip fracture, a flap placement, or any other sort of acute issue. They end up with us on our service. We're medically managing them, as well as doing the rehab part, which is kind of fun. And then just kind of a quick breakdown of what we look like as far as like the 3 years of residency. We do about 12 months of inpatient medicine, 3 months of consults, 21 months of outpatient. So even though PGY 2-year is pretty heavy on the inpatient, we have a ton of outpatient as well. You get 4 elective months split between PGY 3 and PGY 4-year. You also get 4 months of EMG split between the 2 years as well. And then we get 4 months of spinal cord injury medicine at the VA. And we see, like I said, a lot more chronic injuries, which is kind of fun because you get to see what things, the spinal cord injury patients look like once they're out of that like acute phase. As far as call, everybody's most important question, we take home call, which is fantastic. You and your pager become best friends, but we very rarely have to actually go into the hospital for it, which is wonderful. Our week call typically runs Monday through Thursdays, 5 p.m. to 8 a.m. And then weekend call is 5 p.m. Friday to Sunday. That's wrong. It's Monday, 8 a.m. Sorry about that. So we cover the whole weekend. It's really great because you go in, you round on the patients. If you're at Blue Mountain campus, you have to stay until 7 p.m. In campus to be somebody in-house. But then you get to go home and you can take call from home the rest of the day. If you're at the VA, you just come in, round on your patients, talk to your nurses, talk with your attending, and then you can kind of get home and manage your patients from there. And the nice thing about our residency is that we have decrease in call burden as you get farther along. You have 12 weekends as a PGY 2 with 5 weeks of call. And then as you can see, the numbers get less. And everybody takes one holiday. The PGY 2s take the winter holidays, and then the 3s and 4s cover the summer holidays. So it's really not bad. As far as educational activities, we have weekly academic half days, which are Wednesdays. They kind of are on this 12-month cycle where we have a certain type of subject for each month. This month was PGY 2 boot camp, like getting ready to be a physiatrist. So we had short lectures on general physiatry, TBI, stroke, spinal cord injury, and then just a little bit, I think we had a gait lecture too. So it was kind of fun to just review all of that because the PGY 3s and 4s are welcome to it, but the PGY 2s are kind of just getting their feet wet into what it means to be a physiatrist. And then each month after this, we kind of delve into a new topic, like next month, which is literally next week, is sports medicine. So that's kind of fun. And then we have a year-long anatomy physical exam course that the PGY 2s take part in. And then we have EMG didactics for the 3s and 4s. There's a 6 months hands-on ultrasound course that's primarily for the 3s and 4s, although I think these are both going under revision this year. And so we're kind of trying to incorporate it so that there's a little more teaching between the 3s, the 4s of the 2s. And so everybody gets the experience and gets repetition, which is going to be fun to see how it actually unfolds. We also have monthly faculty-led board review based on whatever subject we're in. So this month we don't have it, but next month it'll be sports-based. We also have a monthly journal club that focuses on an essential article from the PM&R website regarding whatever subject we're in for the month, and then an acute or new article that is usually from the Purple Journal. We have neuroscience case conference weekly, where we present different interesting cases, and then we also have morbidity and mortality M&M conference at the VA in Frederick. And these two are also undergoing revision to try and make them a little more integrative between the both of the program sites. And then these are our educational activities, just some of the fun things we've done. You can see, I don't know if you can see my mouse, but journal club, if you are the person who ends up teaching or reading journal club or leading journal club, I should say, you get the cheesehead hat. So welcome to Wisconsin. Chris is really excited to be wearing it here because he is a Chicago Cubs fan and Bears fan and sucks to suck. And then we have gait lecture here, doing our manual muscle testing over here, some spine boarding with the sports people, a little bit of ultrasound practice, I'm guessing this is cervical dystonia stuff with Dr. McGuire. And then this was actually a injection cadaver lab with one of the Botox companies. So that was pretty cool.
Yeah, to kind of talk about the fellowships available at MCW. So the 2 ACGME accredited fellowships that we have here is through pain management, which is through anesthesia, then spinal cord injury, that's through our own program, PM&R. There's also a primary care sports medicine fellowship through the Department of Orthopedic Surgery. Dr. Zock is the fellowship director, and she actually trained here in PM&R. So we do work closely with her, even though she's technically in the Department of Orthopedic Surgery as well. We also have a non-accredited neurorehab and spasticity management fellowship, which a lot of our graduates have recently done for an extra year to really gain that extra experience with toxin injections and to really hone in their skills both on inpatient rehab, but also spasticity as well. And this is a pretty unique fellowship given that there aren't many similar to ours around the country. Our past graduates, we just wanted to highlight over the past 2 years where our graduates have gone. We've had really good success with matches for both sports and then also pain as well. So as you can see, we had a fellow stay here for sports medicine and then one go to Detroit Medical Center. One of our other residents also did the NAS accredited sports and spine fellowship at University of Kansas, had another graduate stay on for spasticity, and then we had 2 go out into practice as well. And as you can see, 2 years ago, again, we had 3 people match into some pretty strong sports fellowship programs, and then also had someone stay for spinal cord, someone stay for pain and spasticity as well. So we do a pretty good job of matching at least in all the different fellowships available through PM&R. Where do our graduates go? This is kind of just, I didn't want to belabor the point of all the programs that we go to and specialties that we go to, but there's a good mix. It depends on each year. Some people are more geared towards fellowship versus practice, but whether you want to go into practice or go into fellowship after graduation, I think that we would suit you because we do have a history of residents doing either or. The longitudinal tracks, there's a research intensive track. I'm not currently involved in any of the research intensive tracks, but and I think that our recent graduate who actually went into pain medicine, he actually did the research intensive track. You kind of start off with the project and work with Dr. Durand, who's the head of research. And it's really an opportunity where if you're really into research, you'll get an extra half day during your 3rd and 4th years to work on research. And the expectation, is to get a publication as an abstract in a journals. And, that's definitely a unique experience where they support a lot of research here. And then also with the medical educational track, our other past chief who's now an attending here, she did the medical education track. She did a project that worked on practicing the brachial plexus with residents and medical students. And she did her own both educational project, but also a research project on that. And we've definitely appreciated that because we've learned so much from her.
Yes.
Life in Milwaukee, it's a decent sized city, about 600,000 in the city, 1.5 million greater metro area. It's very close to Chicago, which is very close to my home. And, you can easily fly anywhere, but the lakefront is great. The riverfront is great. We have a great sports scene. When the Bucks won the championship, the town was going crazy. So if you love sports, if you love breweries, if you love the outdoors, there's great hiking nearby. And there's that lakefront as well. And even though I'm from Chicago, it's much more convenient to get around if you want to live in the suburbs and go into the city or, stay in the city and then go out to the suburbs as well. It's pretty easy commute, about 15, 20 minutes each way. There's the beautiful Milwaukee lakefront. I've definitely visited there quite a few times. I've driven down there. There's like bike paths down there. It's just a great spot to hang out. Here you experience all the seasons. Some people don't like the cold. I personally don't mind the cold as well. I think it's actually awesome in the winter with all the Christmas decorations. And this is the kayaking in the top left-hand corner I was talking about. Through the riverfront, you can kind of like bar hop and hop to different restaurants and go to different places and try all the different foods while kayaking, and you just tie up and go into that restaurant. And then in the bottom right, that's the music festival, Summerfest, that I actually just went to and just blanking on the name now, but it's really awesome. There's so many different performers there. They've kind of changed the setup now where it's just on the weekends, but it's a pretty sweet experience where you can see any artist of any genre throughout the whole festival. It's a pretty good time. And then festivals. There's tons of different festivals. I'm not going to list all of them. Wisconsin State Fair is great. I've personally been to there. One of our attendings, Dr. Kutsonis, who's the assistant program director, his family owns a brat stand. And if you tell them you're with MCW PM&R, they will feed you free brats. So that's always a fun time to visit the Wisconsin State Fair, and all the other fests are great too. Sports, like I said, we're a great sports town. Even though I'm a huge Chicago sports fan, it's always fun to see my away team play at, the Brewers Park, play the Bucks, and then there's also the Milwaukee Admirals and the Milwaukee Wave as well. So if you like any sports, there's tons of professional sports to watch. You can go up to a Packers game. It's only a couple-hour drive, and there's actually like shuttles that'll take you up to Lambeau and then take you back the same day. So definitely have a huge sports scene in Milwaukee. All right. Other activities kind of listed here. There's just a plethora of activities. We all love Milwaukee. If you have any further questions, you can always let us know. And then just our program, we did participate in the wheelchair games. We do it every year. These are the shirts that we got. Being the Wisconsin team, naturally we have cow t-shirts. But it's a unique experience because we get to provide medical coverage for the largest wheelchair athletics event in the country. So if you're interested in sports medicine, this is something that'll set you apart, and it's very unique, and only a few programs get to participate. And Dr. Lee is actually the head of the wheelchair games, so we are always guaranteed someone at these games.
5-minute warning.
All right, and then resident activities. This is just us having a good time at different social events, and doing other stuff as well. Again, this is us during our retreat doing whirly ball, going to different games as well, and just more resident activities. So I know we don't have much time, but if you guys have any questions, you guys could feel free to shoot them out and we can try to answer them, or you can email us as well.
Go to email. Okay. Is there anything in the group chat? I don't know how to see that. We're clearly really good with tech.
Any questions at all?
Oh, there's one. Nope.
We have one in the chat. I don't know if you guys are able to see
Yeah,
that.
so we, I wouldn't say that we don't interview IMGs. We've definitely interviewed IMGs, and in the past, at least, I don't think we've accepted anyone to my recent knowledge, but we've definitely interviewed people. So I wouldn't say that, if you're an international med student, that you would not get an interview or not have a chance of getting an interview. I think that we look at everyone.
Any other questions?
Yeah, so pediatric exposure at the program, it's pretty strong. Initially, our biggest complaint was that if you're interested in peds rehab, there's no inpatient peds rehab, but now we're opening 3 to 4 beds. Our program director is actually, she works at Children's and does peds physiatry. So you do get a good amount of exposure 2 months during your PGY2 year, and then during your PGY4, you have an elective as well. So you can definitely design it if you want to have more peds experience.
And then as far as OMM, we honestly don't use a ton of it. We do have a fairly even split between DOs and MDs in the program. We just don't tend to use it a lot. I know I get a lot of referrals, at least in the sports medicine clinics, from people who do OMT. And so it's definitely something that is favored within the Freighted system. We just don't personally practice it. Any other questions?
If there aren't any other questions, thank you, MCW. Great presentation.
Thanks.
Yeah, and so if there's any other information, Chris, that you want to send out to everyone, just send it on to me and I'll make sure it gets into the right hands.